Good morning. My name is Wojtek Goscinski. I'm CEO of National Imaging Facility, and I'm very pleased to be giving this update at the Global Exchange of Experience. And I'm very sorry that I can't be there in person. Today, I thought I would just give an update on the activities at the National Imaging Facility. I want to just give you a little bit of background to NIF for those of you who aren't aware of our activities. Provide you a little bit of an update about how we're organizing ourselves into networks of capability, and talk a little bit about our activities in artificial intelligence. Just by way of background, Australia is quite well organized with respect to national research infrastructure. Australia has a program called the National Collaborative Research Infrastructure Strategy. It's funded by our Department of Education. It operates on 5-year cycles, and every 5 years we develop a national roadmap for research infrastructure, which then flows into an organised funding strategy under the NQuIS program. It's a co-funded program, so it's co-funded by institutions, state and Commonwealth. There's about 28 capabilities funded across Australia. A National Imaging Facility is responsible for implementing and providing advanced biomedical imaging equipment and expertise. So we provide access to imaging equipment, expertise, tools, data, and analysis. We provide open access to over 100 instruments across Australia, and we co-fund around about 100 experts across Australia whose job it is to provide excellent service and excellent capability to develop experiments, analyze data, and to get the most out of our equipment. We are 14 partners across Australia. That's universities, medical research institutes, and also our nuclear facilities in Australia. We support thousands of researchers. We have a strategy that we are working towards as National Imaging Facility. It includes expertise, that is to provide access to excellent expertise across our network. Technology, providing researchers with access to newest biomedical imaging technology. Impact, the way that National Imaging Facility does this is by helping research translate from discovery through to a product or a change in practice. Data, our job is to help generate valuable data collections and provide our researchers with the capability to manage and to analyze that data. And collaboration, a really key goal of the NQuIS program. Overall, it is intended to be a collaborative program rather than a competitive program. Our programs include advanced human imaging, preclinical and frontier imaging, radiopharmaceuticals, and as of the last year or two, we've expanded to include a dedicated digital program, imaging data collections and partnerships, and I'll tell you a little bit about that today. Our technologies are the sort of technologies that you would find in a clinical setting, except we run them at absolute peak. We provide access to molecular imaging equipment, including Australia's 3 total body PET systems. We provide access to advanced MR, 3T, 7T, hybrid PET MR systems, and ultra low field MR as well. Provide access to Australia's 2 MEG systems, access to radiochemistry, that includes laboratories, and cyclotron radioisotope access. And we also provide access to the digital infrastructure, and increasingly probably the AI soon as well, the digital infrastructure that you need to capture imaging data, manage it, publish it, and analyze it. As I mentioned, we are distributed across Australia, and this is really important in 2 aspects. It's really important that we have a presence in biomedical imaging precincts where a lot of research activity is across Australia, but also it's increasingly important that we have population coverage. We are a human imaging facility, and it's really important that we're able to provide researchers with access to Australia's population for the purposes of human imaging studies. Next up, I want to just provide you an overview of some major activities that we're doing to adopt new network models of operating across our facilities that are more collaborative, working as a national network. They include our human molecular imaging and our digital infrastructure activities. As of earlier this year, we created a human molecular imaging translation network. This brings together 10 digital PET and total body PET cameras across Australia under a single agreement to collaborate and to devote a certain proportion of staff time to shared challenges. In total, it's 15 co-funded staff positions across 8 partners across Australia, 8 universities and medical research institutes. It includes a single governance structure that provides leadership and coordination across these disparate facilities. And it also aligns with major Australian molecular imaging user communities, and in particular, those are in the cancer domain and in the dementia domain. It's a funded program of around 10 million Australian dollars over 3 years. The 3 main priorities that the program is addressing, firstly, is in cancer, harmonisation and credentialing of all NIF molecular imaging scanners, which is coordinated by Queensland. In the neurospace, we're developing new amyloid PET imaging analysis techniques to support clinical trials coordinated by Melbourne University. And in the radiochemistry space, we're standardizing radiochemistry synthesis across all NIF sites, and that's coordinated by ONJ-CRA Latrobe. The next network that I want to highlight is our foundational data infrastructure network, committed by the National Imaging Facility Board earlier this year. And it is developing a consistent data management environment to support all NIF nodes, essentially, that seek to participate. It includes a technical roadmap that helps plan for the future, support model for node partners, national scale projects, data partners and users, a funding model that supports continuous improvement and expansion, and includes, again, a governance structure that sits above these activities to provide guidance and leadership. A major part of that project, the Foundational Digital Research Infrastructure, is the Australian Imaging Service. And the AIS is a unified federated suite of national services for capturing, managing and analysing imaging data. It's an environment that will be deployed across 20 Australian imaging sites. It uses established services, including XNAT and Eurodesk. And the program itself that we're participating in includes 6 activity streams that includes leadership, capture, data management, analysis, and community. Its value to National Imaging Facility is that over the coming years, we will have a consistent environment across our partnerships, across our nodes. That ensures that all of our users across Australia will have access to rich data environments that they can use as part of their experiment, but it also ensures that we internally can collaborate more effectively by using consistent environments. Finally, I just want to say a couple of words about NIF's increasing role in AI and specifically foundation models. One of the things that we've been talking about in Australia is the way that research infrastructure and AI intersect. With the increasing adoption of large AI models, we do tend to think that these large models take on aspects of research infrastructure increasingly. Recently, we made a proposal to our funder, the Department of Education, that large AI models are research infrastructure. They're just like a telescope or a scanner in many ways. They share many of the same attributes. For example, they are high value, which means typically they're expensive. They're requiring coordinated investment due to their scale and cost. They're equitable, leveling the playing field, providing everybody with access to a rich environment. Reusable, trained once, but reusable too. many different downstream applications without repeated redevelopment, perhaps retraining. They're scalable in enabling diverse projects, enabling a wide range of research questions to be applied and asked. And in many ways, they're sovereign. It's a phrase that's been thrown around quite a lot recently, but I do think that it's very relevant in this context. They build Australian capacity and intellectual capital in an area that Australia dearly needs to grow in. With that proposal to the Department of Education, we have also started a pilot project in partnership with Monash University and the Alfred Hospital. This is a medium-scale foundation model. It's trained on Australian clinical and research MRI plus clinical data. It's fairly modest, 18,000 MRI scans from National Imaging Facility and from the Alfred Hospital. And its intention is to support downstream retraining for epilepsy, traumatic brain injury, stroke, dementia, and a number of other areas. And the projects that will be supported are already identified. It will also establish a secure governance and image data transfer network, specifically because a lot of the data that we're talking about is clinical data. So it's critically important that we operate within appropriate ethics and governance frameworks. In Australia, there is a major discussion occurring with respect to how Australia should respond to the AI revolution. And it specifically addresses a number of major Australian policies in this domain. With that, thank you. I'm very happy to be providing you with an update on some of National Imaging Facilities' activities. Please do subscribe to our newsletter. Thank you.